everybody, it's Shakira, aka the Dope Doula. I am back not only with my final video in the How to Get Pregnant and Getting Pregnant series, but also my final video for 2020. As we close out the year, I am going to be spending time with my loved ones and checking in with my community. I also have some writing fellowship applications that I need to get done before the start of the new year. I hope that as we are turning towards 21, you are also using this as an opportunity to decompress from all that we've experienced in 2020. Now, in this final video, we are going to be talking about prenatal vitamins. I'm going to walk us through what they are and why we need them in the getting pregnant phase. I'm also going to talk about what to look for in a prenatal vitamin and when you should start thinking about taking them. So first and foremost, prenatal vitamins are nutrient supplements that a pregnant person or someone getting pregnant takes on a daily basis to ensure that they're getting enough dosage of certain nutrients that are essential for birth development of your fetus and embryo and baby. When you're looking at prenatal vitamins and the difference between a regular multivitamin, a few things stand out. First and foremost, prenatal vitamins contain double the dosage of certain nutrients and vitamins for both the pregnant person and also the baby. In particular, prenatal vitamins contain a really high volume of zinc. Zinc is really essential for the development of your baby. It helps to lower the risk of certain birth defects, in particular spina bifida, which is essentially Latin for a split spine. And that is just saying that this particular birth defect has implications on the development of your baby's spine. And so zinc is really important for lowering those birth defects and ensuring that you are creating the most potent atmosphere for a healthy and strong fetus. Along with that, prenatal vitamins contain high dosages of calcium and vitamin D. As you know, calcium and vitamin D are very essential for strong bone development and bone health. Often, a lot of pregnant people will report that during their pregnancy, they notice that their teeth will start shifting or their bones will start cracking a bit more. If that happens, that's a really strong indicator that that pregnant person needs more calcium and vitamin D in their diet and also in their prenatal supplement. Prenatal supplements also contain more of the traditional vitamins that we get in our diet. And again, they are a double dosage, enough for the pregnant person and also for the baby. One of the other key nutrients that we want to be looking for is iron to ensure that the baby's blood has a really strong volume of iron to reduce the risk of iron deficiency, especially in the pregnant person. When your baby is starting to extract nutrients from your body, they're always going to take what they need. And so these prenatal vitamins are assuring that as the baby is taking the nutrients and supplements that the baby needs for its own body development, that your body, the pregnant person's body, has enough of those nutrients to remain healthy throughout the duration of your pregnancy. What I like to recommend when you are looking for a prenatal supplement is that you're looking for either a vegan or vegetarian option of that supplement. And the reason for that is because the development of a vegan or vegetarian supplement is going to come from more natural elements like really leafy green vegetables versus being artificially developed and containing a lot of dye and a lot of other artificial ingredients that can create toxins in your body. Another important element that you want to be looking for in a prenatal vitamin is folic acid. Now, you can get folic acid from eating leafy greens, those vegetables, like I said, and you also want to make sure that you're getting that in your prenatal supplement. A lot of times when you're taking a prenatal supplement, you have to go through a number of them to find the one that's right for your body. Some prenatal supplements require that you take them twice a day. If you're this type of person who it's really hard to remember to take your supplements, you probably want a pill that you have to take once a day. You're always going to want to take that with a meal to avoid nausea. And of course, you want to talk to, if you're using a nutritionist during your pregnancy, as well as your doula and midwife or medical care provider, getting their opinion on the type of prenatal vitamin that you should be taking, depending on your health condition before pregnancy and how your health is evolving throughout your pregnancy. Now, I like to recommend that if you're thinking about getting pregnant, you want to start taking a prenatal vitamin right away. At the very minimum, you want to be taking it at least 6 months before conception, and ideally, you would want to take it a year before conception. This amount of time before getting pregnant allows your body to start building those vitamins and those nutrients in your body. It's okay if you don't start taking a prenatal vitamin until you get pregnant. A lot of people do. It's even better if you can start taking it before, because it takes a while for those vitamins and nutrients to actually start to kick in. It can take up to 2 to 3 months before you really start to feel the effects of a vitamin or a nutrient supplement. So getting that supplement, getting those nutrients in your body ahead of time, not only allows your body to get used to it, but also you're already building up those vitamins and nutrients before even conceiving. And a prenatal vitamin before getting pregnant can also be really helpful in the process of getting pregnant. Having things like zinc and that folic acid already in your body can, in some cases, increase your opportunity and your chances for conception. Now, another thing that I like to encourage people getting pregnant to think about taking as part of their dietary supplement is what's known as Irish cmos. My family is from the West Indies, so this is a very popular superfood for people who grew up in the islands, in certain Latin American countries. Irish cmos is essentially a seaweed that is really high nutrient rich. It contains everything that we just talked about, your zinc. It contains the right balance of iodine. And if you are going to be taking Irish cmos, you want to be really careful who your supplier is and how it's getting made. I take it as a gel supplement. I'll mix it in with my smoothies or in tea. Both my husband and I take it in the mornings because it reduces mucus in the body, so it allows your bones to stay really flexible. Again, it's high nutrient, high in iron, high in vitamin C, high in folic acid. It helps with digestion. And when you're pregnant, things like gastritis and acid reflux and nausea are very common, and Irish cmos can help reduce some of those symptoms of particularly the first phase of pregnancy. So I am taking it for some digestive issues that I have. Irish cmos is also really good for increasing your libido. So if you are in the phase of conception, that's an added benefit of, a higher libido to get, going and enjoying the process of making your baby. And so making sure that you're continuing to talk to your health provider, your midwife, and also your doula, if you're using a doula, about these different options and decisions as you start to build out your supplement program. And so this has been an incredible year. I just want to thank everyone who supported me. I want to wish you all a happy new year, and I am so excited that I'm going to be coming back with even more incredible content for you all in 2021. As always, if you're watching on IG, turn on your notifications, follow, share. If you're watching on YouTube, please subscribe and share this with someone who you know might need it. Until next time, bye.